was driving at is, it's therefore not enough for anybody to tell a pregnant woman or a nursing mother who doesn't seem to be coping well that what's wrong with Dodo?
Thank you.
Or, you are not the only pregnant woman around. You are not the only person with a baby.
Thank you. You're not the only one who has given birth before. Are you the only, because you see, the maternal mental health disorder, we have it in various forms and severities. The commonest you may hear is what we call the postpartum blues or baby blues, where the woman has delivered. The next day she's just a little moody, not too happy, because she's just not sure how she's going to fit into the new role of a mother. Am I even going to be a good mother? But those are short-lived things. Within 5 to 7 days, it goes away.
That phase goes away.
The next one is anxiety, postpartum anxiety. The woman has delivered and she's extremely anxious. She wouldn't allow you to even touch the baby. She's extremely anxious. That, in a large majority of cases, with a bit of counseling, reassurance from the healthcare providers, clinical psychologists or mental health nurses, they cope, and that also goes away soon. The next big one is the postpartum depression, where her mood is low. She cannot smile. She's just low in energy, deep from within. She can't explain what is going on. And she can't even bring herself to say, I'm going to look for help.
Oh.
We had a doctor who went through and was sharing a story with us in the National Forum a few weeks ago. She's a psychiatrist. She knows the subject thoroughly. And she suffered this postpartum depression. She just said, I just thought, okay, maybe I'm just going to die, so why bother? Yeah, it can get that deep. And she knew that I needed to talk to my other colleague for help. But she didn't feel the energy and the need
to do it.
And I have learned that is also part of the problem. That's how it also manifests. Okay? And so the woman will be severely depressed. Sometimes you say, no, I haven't delivered, though. That's not my baby. Take the baby away. I don't want to see the baby. And a lot of people can relate. But there hasn't been the opportunity for them to speak about it. Okay. And the worst one, which we dread, is when it becomes psychotic. We call it postpartum psychosis. Psychosis means the brain is hearing voices when nobody is talking. It's making you see things when there's nothing there. And so this woman, the brain tells her that there is something terrible about to happen to your baby. And that thing is much worse than dying.
Hey.
And so you need to save your baby from that thing by you killing the baby yourself.
Oh, no.
Yes.
She went through that?
And they do that. And the woman will kill the baby because the brain is malfunctioning. So the brain says, this is the way to protect your baby. It's called maternal intrinsic delusion. And so they kill the baby. That's what we call infanticide. They kill the infants.
Wow.
That's a severe form when they have postpartum psychosis. And so there's a medical explanation why a woman after delivery will not be in a good mood. There's a medical reason. So it's important for everybody, including the family, to be a lot more supportive.